So I'm Dr. John Artis, but yeah, we talk about healing from the inside and out. Basically, this is a wellness reset for your nerves, your balance, and your whole body. So I want to just talk about different things. Some of the stuff you might have heard of before, but it kind of builds on if you've been listening to me before on what I've been talking about. But I congratulate you for being here today because you're supposed to be here, and I guess you're supposed to hear this. Otherwise, you would have been somewhere else, right? So this right here, let's just a little bit about me is that you're guide the whole body. But the thing, what I want to say is that health on earth was built on the whole premise is that your body was designed to heal itself. All we got to do is create the right environment for it to do so. I'm a strong believer in faith in God, and God designed the body to heal. And a lot of times it can heal from anything. You've seen people heal from cancer. You've seen people heal from all kinds of stuff. So if you can heal from cancer and all kinds of stuff like that, you can get your balance together. It's very simple. It's a lot easier. I'd rather get the balance together than heal from that. So we just got to create the right environment. So today is building the foundation for you to create the right environment to be able to do that. And just a little bit about me. I'm a Palmer graduate of chiropractic in 2005. I'm a graduate of a HBCU, the best HBCU, NCANT State University, 1998. And then I was in the pharmaceutical industry for probably like 3 years before that. And in the pharmaceutical industry, I dealt with dosing monkeys for drugs that some of you probably take to this day. And a lot of times I saw the side effects of those drugs, so I knew that that could not be the answer for everything. A drug is just not the simple answer of every time you get sick to take something. So, and that's what we want to build on. And then I just like to say that I'm Tinley Park, Chicago's whole body wellness expert. I try to live it. And a lot of this stuff right here is that this is not just what I built from Health on Earth. When we started with it, writing this name on a sheet of paper, I lived it. And a little bit about my story, I grew up, I always had asthma, allergies, and all these different things. And when I started going to a chiropractor getting adjusted, I haven't used the asthma pump since. And I didn't go to the chiropractor for asthma. I went to the chiropractor because of my knee. And I noticed that once my body started getting aligned and the nerves didn't have pressure on there, my body started working properly. And so I stopped overlooking just simple stuff as far as nerve function, what I'm going to talk about today. Because a lot of that pressure on those nerves is why you're experiencing a lot of the stuff that you're experiencing as far as balancing and numbness and tingling. So what you didn't come here by accident, but something you need to know is that you want more energy, you want more balance, you want more clarity, you want to move freely. So the number one reason why most people come into my office is because they're not moving the way they want to move. Or one of the number one reasons right here. So how many of y'all moving the way you want to move now? Or you know you can move a little better? Right? Amen. Can I get a call? That's very good. So right here, the thing about it is I don't claim myself to be the hero or anything. I'm just a guy in the story. You're the hero. It's your body, and you can actually determine how you do it. And I want to help you to do that today and look at these different things. So do any of these sound familiar? You got fatigue that doesn't go away. No matter how much sleep you get. I mean, I've even been there. I mean, I've had to have coffee in the afternoon to kind of keep myself going, just stuff like that. Also, aches and stiffness and pain that become normal. I'm just getting old. That's just what it is. That's what some people say, right? And then the other thing, too, is brain fog, poor sleep, or they just get this persistent stress. Just always something nagging and something always popping up that's not right. And then we got the last thing, numbness and tingling and burning in your hands and feet. That's a huge one. The other thing right here is feeling off balance or worried about falling. That's a huge one for a lot of people in here. And then knowing something is wrong, but not knowing what. A lot of times we go through life and people, they'll just keep ignoring stuff. And you know something is off. Like a lot of times people never really surprise me when all of a sudden they got this full out blown disease. They saw some stuff that just didn't know what it was or never really followed up on it. And I've seen that happen with people right there. So the real problem is not what's going on. So a lot of times we tell ourselves, with the symptoms, this is the problem. So we got external, the way we deal with it. Externally, you can actually feel numbness and tingling. You can feel the pain on my back hurt or the stiffness. Externally, you can actually see that. That's external. A lot of times when you go to the doctor, this is all they treat. When you look at problems, you got to look at what the internal things right here. Internally, you start telling yourself, I'm getting old, there's nothing I can do. Just part of age. I just live a little bit, right? You're going to get the sciatica. You're going to get all these different things. And then the philosophy right here is that the truth be told is that you deserve to have an age with strength and grace. You deserve it. I'm going to stand a witness on that until I turn 99 or 100. And I still think that you can actually train a muscle no matter what age you are to actually do what it's supposed to do. I was at dinner with some friends last night. A friend of mine was in town and his coworkers, and then one guy, you're a chiropractor, so people start asking all these questions. And I was like, man, you just train a muscle the way it could be. And these guys, one was in his 60s, but he's talking about this pain he's having. But you can look at his posture, you can tell, I see why he's having pain. And so he's just trying to explain it that so he doesn't go through these different processes. But let me show you what the real problem is. The real problem is inflammation. That's what's going to real culprit for a lot of people. It's the root of almost everything. And one of the things it is 7 out of 10 people over the age of 45 have some level of chronic inflammation. Now, some of y'all might be having to the point where you got it balanced, but these younger people, it's chronic levels of high inflammation and it's destroying the nerve roots. That's why I don't think the younger generation is going to live as long. You guys are retired. Plus, it ain't when you throw no pensions in there and then you got to work for the rest of your life. So it's a different mindset. So look at these things right here. When you got chronic levels of inflammation, it destroys the nerves. It creates numbness and tingling. That breaks down joint cartilage. Inflammation will tear your knees up, your disc in your back, if you got chronic levels of inflammation in your body. And then it disrupts your gut health, which is we're going to talk about that. And then also, too, it impairs circulation. The cold hands and feet accelerates aging throughout the body. So you want to get older faster, keep inflammation around. The main thing right now, that's why ginger and turmeric and all these different things are there, is they're trying to fight inflammation. And we got to talk about ways that you can reduce that. So 5 pillars to whole body health that we talk about. Number 1 is it controls everything. What controls everything? Don't all say it at once. The brain, yes. But what is the brain part of? Come on, you got it. We're on the right track. You got nerves, nervous system. So the nervous system, it controls everything. So nerve health. If nerve health is functioning properly, you're going to be moving properly. Then you got the second pillar, which is circulation. This is the delivery system. This is what gets the nutrients all over your body. So your ankles are swelling. That means your circulation is off. Them compression hoses, you need to put them on a little bit more. And don't pull a muscle putting them on, right? Because they're so tight. The other thing you got right here is you got the silent disruptor, which most doctors never talk about, is inflammation. You got to reduce ways of having inflammation throughout your body. And we'll talk about that in a little bit more. And then the foundation is a spinal alignment, which I talk about. That's if your body walking around like this and you all shifted like this or you walking. I always tell people the quickest way to get old is let that posture go. You start doing this. I had a returning patient, Mr. He came in, David, I can't remember his last name, but he's like, I said, man, stand up straight. He said, I am. I said, no, man, we got some work to do. So that's your foundation. You got to get that together. And then you got the 5th one is your lifestyle and your gut health. That's what you eat. That's what you feed in your body. And what happens, why this is so important, you could be deficient in certain minerals and vitamins. And so certain minerals, especially talking about nerves and stuff like that, that could be vitamin B. That could be vitamin D. It could be magnesium. There's so many different things that we can look into with that right there. But these right here are the 5 pillars of whole body health. And everybody's different in different ones, right? So we'll give you an example of circulation issues. That could be diabetic neuropathy. That's if you're a diabetic and now all of a sudden you're getting these sores on the bottom of your foot and it might get infected. Or you get to the point where you damaged a knee, you had a knee replacement, and then all of a sudden the ankle just swells more because the circulation is off, right? You got also nerve damage right here where you got spinal canal stenosis. You got degenerative disc disease where you have no pressure and it's so much pressure on the nerve that it's compressing the nerve and you feel that peripheral neuropathy down your legs or into your hands coming from your neck. Those are things right there, the 2 most common things. The misalignment thing right here is if you sitting there playing this game. I sit there and I talk. They playing Monopoly on the phone now, a lot of people, and they sitting there for hours, and these games going for a week, right? And they playing with different family members and stuff, and they wonder why their neck is hurting. I see people literally in my office just talking about that. And so you got to stop them with that, and then also the deficiency in the vitamins. So what damages your nerves? Number 1, nervous system health is everything. So this controls everything, 100 billion nerve cells, and they connect together by different synapses. Man, that's loud, but it's going to be okay. What damages the nerves? Blood sugar imbalances, prediabetes, all those things can do it. Chronic inflammation throughout the body, misalignment, compression on the nerves, poor circulation, starving the nerves of oxygen. When you don't have the body circulating properly, what happens is the nutrients aren't getting to the nerves. That's what happens with diabetes, and it destroys the nerves with diabetic neuropathy. So what I'm saying is, when you think about diabetes and stuff like that, I always think about it in my mind as little pieces of glass floating through the bloodstream. And what they do is they destroy the smaller blood vessels, like the capillaries. They destroy the eyes. That's why the people with eyes with diabetes are bad. The bottom of the feet, the fingertips, they get numb because the nutrients aren't getting there. And then you got nutritional deficiencies. When you deficient in vitamin B12, I'll tell you about that patient that was deficient in vitamin B12, and they thought she had MS, but it wasn't. And they found out it was a vitamin B12 deficiency because she decided to be vegetarian and wasn't eating meat, but didn't do it properly, wasn't eating beans, was eating all this processed stuff. And so what happens is they can destroy nerves, and that can turn into a permanent condition. Vitamin D3 and magnesium, I talked about that. Chronic stress hormones bathing in nerve tissue. So that's when you got stuff like cortisol. That's the stress hormone that I'm talking about. If it's just sitting on that nerve tissue, it's going to destroy it. It's going to destroy it. And that's one of the things why when people are stressed, they hurt more. They hurt more. Now, you don't have to just live with it. Number one thing you got right here, neuropathy, is what happens is when you damage nerves. When you damage nerves in the neck, you can cause that radiating pain or bring this down in the fingertips. Like I got a guy, he has a herniated disc, which is pressure from the nerve back here, and he can't feel the bottom of his foot. And then his calf is locked up, his hamstring's locked up. It's the whole way pathway down that nerve. And so when you look at these different things, is we had to get him out of that crisis, and we did it by treating him for peripheral neuropathy caused by the disc herniation. And we did it by laser because that stimulates nerve regeneration if it's not too bad gone. Like you got people that have chemo and they got nerve damage. You ever heard people who had chemotherapy where they had breast cancer or some kind of cancer and it destroyed the nerves? Yeah. If it's not too bad, you can regenerate it a little bit. But if it's continuing to go bad, like some people, when they get that discoloration, that's like killing stuff in their body. And that's what you got to do to beat cancer. But that laser can help do it. And then we got circulation boost, which restores oxygen through. That's training your body to actually increase blood flow to those areas that are not getting blood flow. And when that happens, that changes everything. And then when you take and put the body in the right alignment, if you walking and somebody's got one hip that's 15 millimeters up and the other hip is down, there's no way that your body's going to function right. It's going to put pressure on it. And that's what you got to make sure that if you can get those things in order, it's going to change everything. So you just don't have to live with it. And I can't guarantee you that it'll go away, but it will minimize. I've seen it happen. Now, the body has a second heart. Y'all know that? You got a heart right here, but you also got a heart right here. And the reason why they call the calves the second heart is because that's what pumps blood throughout the lower extremities. So what happens is when you the heart is up here, so it's closer to the arm, so it can pump more blood throughout the arms. But when you get down and you're working against gravity down here, and you stand up on your feet all day, that blood circulation is not going the way it should. So what they do is they say calf raises right here is a second heart because it pumps blood back up against gravity. That'll help with varicose veins. That'll help with those spider veins. It'll help with a lot of those things. That's one of the favorite exercises I have people doing with that is they start doing calf raises to where they stand against the wall and they're basically lifting up on their heels to pump. How many of y'all just went on a plane ride? If you're on a plane ride or you're traveling and you're sitting for a long period of time, you can sit down and you can actually take your legs and start doing calf raises to help with that circulation, along with your the tight compression socks. And you can do the toe raises. Toe raises is another one. But you got to keep this moving because you keep this moving, it's going to help work against gravity and keep that circulation going in the body. And that can actually help right there with cold hands and feet, fatigue and brain fog, slow healing of wounds. That also can help with swollen ankles and legs, and then numbness and tingling in the legs because the oxygen delivers the nutrients to the nerves. And if you can get the oxygen to deliver the nutrients to the nerves, it's going to help you to function better. The other thing you got right here is daily movement. 10 minutes. 10 minutes of moving in your house. You got a commercial come on sometime with your favorite show lasts 10 minutes if you got back to back. And you just walk around, move, pick your feet up, go up the steps, go down the steps. You know, don't just go and get a ranch level house first. If you got steps, try to hang in there as long as you can because it's going to help you maintain a certain level of strength. Then you got chiropractic adjustments. They improve nerve flow. Laser therapy stimulates microcirculation. Anti-inflammatory protocol, targeted supplementation. When those are natural solutions you could do to actually help do it. And that's not with a lot of side effects or drugs, right? And that's one of the things you got to look at with that, with the poor circulation versus the natural solutions. So you can do something about it. Calf raises, number one, and hold on to something and you just kind of lift yourself up. And if you can't do it, you got to just do what you can. So you basically are standing and you're going like that. Now, your spine is your body's power grid, right? So when you talk about a power grid, and I'm not an electrician, but I'm an electrician of the spine, not a neurologist, but a chiropractor. And what happens is you got the neck, which is the cervical part, the middle part of the back, which is the thoracic part, and then you got the lumbar spine, which is the low part. So what happens is if you're constantly having headaches, arm pain, stiffness, and sleep disruption, we got to look at the cervical spine. If you're constantly having chest tension, mid pain, breathing restriction, we got to look at the thoracic spine. If you're constantly having neck, low back pain, sciatica, numbness in the legs, and hip issues, we look at the lumbar spine because those nerves could be compressed. And so if you can actually remove that interference, that can allow the body to communicate with the rest of the body properly. And that's what we got to get. 31 pair of nerves exited. If you put pressure on one, so if you got pain that goes down to the top of your foot, that's usually that L5 vertebrae that sits right here. That's common with most people. S1 is the bottom of the foot. Those nerves come off and they come down the leg like that, all the way across. So they come across. So when you tell me I feel pain here, I know what nerve to go to in the spine. If you tell me it goes down here, it goes all the way into the foot. That's how we know. Those are called dermatomes. Same thing with the hands. People say, I can't feel my index finger. It's numb in the tip. And this finger right here, that tells me C6, C7. If I can't feel stuff right here, that's C5. When I had a disc bulge in my neck, I had 3 disc bulges in my neck from a fall or something. And then I could feel like water running down my arm. And then the arm got so sensitive that I could lay in the bed. And then what happened was if the air was too cold, hit my arm, it was hypersensitive. So when I took the pressure off the nerve, that stuff went away. Does that make sense? And some people get like a dull sensation. Some people get a hyper sensation. All that is nerve irritation. And that's something that you got to watch for. That's your power grid. Now, your gut is your second brain. It's the 5th pillar. This is your second brain. So your first brain is here. Your second brain is here. The reason why they call it the second brain is because this is how nutrients gets inside your body. And so when you look at this right here, 70% of your immune system lives in your gut. That's why they say we got to when they boiler alert. You can't drink the water. You can't because you're gonna get sick. Listeria, you could die. E. coli, all these different bacteria stuff. When you traveling outside the country, you're feeding your body healing every day, or you're fueling inflammation. If you're doing chronic levels of ice cream and all that stuff like that, and sugary foods, it's gonna destroy your body. So what inflames your gut? Number one are processed foods. Any kind of foods that come out of a package. Packaged foods. You got to eat more whole foods that come from its whole source. You got seed oils. How many know what seed oils are? Seed oils are almost in everything that's packaged. That's how they actually do it. That old canola oil, you got all those different things. If you're going to use something, use olive oil, avocado oil, coconut oil, are usually better than the rest of the typical seed oils. Refined grains. Refined grains. I was talking to my neighbor who's allergic to something, and so they started making bread. He says it's a game changer, so I'm supposed to taste it this week. And then alcohol destroys your gut. It all inflames your gut. And you don't want to have that inflamed gut because that's going to throw everything off. And you wonder why your immune system is going to drop. So when I talk about the gut, I'm so passionate about the gut thing. The gut, when you look at the lining of the intestines, right? It's like you got these microvilli like this. And so when you eat food, it goes through and it pulls the nutrients through that need to get through to your body. So when you eat something that's got vitamin D, vitamin E, the body breaks it down. It pulls it in through the bloodstream. It goes in the bloodstream, and it takes it down to the legs to stop with to help the heal. Now, if the gut is messed up because you've been eating a lot of processed foods, or you've been drinking alcohol, or doing these different things and sugary foods, and that's with all of us because we're not perfect. What happens is it destroys that lining. So now those things are open wider. So now when you eat stuff, more stuff goes into the bloodstream. When more stuff goes into the bloodstream, the body activates all this stuff and it starts to try to fight it off. And if it does it too much, it triggers an autoimmune disease. This is how people get autoimmune diseases. That's why this is so important. This is your rheumatoid arthritis. This is your MS. This is cancers. And so it shows up different ways in different people. And that's simply just by eating bad stuff. Now, what heals the body is you got leafy greens. I'm going to close the back that door. You got leafy greens. You got omega-3s. Then you also got fermented foods. Fermented foods are things like what? Sauerkraut, which is good. Yogurt. Yogurt is very good. Greek yogurt especially doesn't have a lot of preservatives in it. It's going to tend to be a little bit more healthier. And then you got also stuff like pickled beets is a good one. You know, when and there was something to that too. I mean, I grew up where my grandmother used to like ferment stuff. She would put stuff in the can or the glass jar and it would sit and it would kind of that fermentation. That was actually very good and healthy for your gut. We don't eat like that anymore. Take time to preserve and process foods. And then you want to get good quality protein. Ladies, if you don't listen to nothing else I say, you got to get enough protein. Muscle mass is your biggest insurance policy. That's your best thing that you can do. If you don't have a right amount of muscle mass, your body's not going to be able to maintain itself in balance. So your legs, the stronger your legs are, good. She got her protein. The stronger your legs are, the longer you're going to live. If you lose your legs, you increase the risk of falling and you lose your independence. And you lose your increase of falling, your independence. Now you got to have a walker or a cane, you'll fall risk. And the worst thing can happen if you fall. So that's very, very important. These things heal. So every time you eat, you want to try to get at least one of these things in your food or on your plate. And I'm going to talk about that in a little bit. Now, what supports it? This is where you got your probiotics. Some of y'all just came back from the Bahamas and stuff and on these cruise ships. You should have been loading up on probiotics before you went because it exposes you to different types of bacteria so your body can actually learn to fight off all some of that stuff that you might not be used to eating, right? And then you got right here, collagen peptides. You don't want that skin to sag? You got to get some peptides in there. When you lose muscle mass in the dexterity of the skin, it starts to just drag and hang down. And that's one of the things to do it. Vitamin B vitamins, and then D3 and magnesium glycinate, which is my favorite supplement of all time, hands down. I take that every day. The best cocktail to sleep is you take about 500 milligrams of magnesium glycinate and ashwagandha together. You will dream. I woke up like this. I love it. I love it. That you take that 15 minutes before you go to sleep. Yes, ma'am. So you got the wrong magnesium. So magnesium citrate, you take glycinate. Well, your body might be a little sensitive to it. So maybe pull back on the dosage. How much dosage is it? Do you know? 300? Yeah. What magnesium glycinate does is it loosens everything up. That's why it makes you easier to it relax your nervous system, but it loosens everything up. That's why it can cause you to go to the bathroom. But magnesium citrate is specifically designed to actually loosen the bowels up. It targets the bowels. But most people are deficient in magnesium. Most people are deficient in it. But you want to strengthen your immune system, stick to this. You might want to take a picture of this, but this is the way with the pillar 5 and strengthening that gut. It's a very big thing, and it's something that we focus on the knee, but we don't focus on the gut if the knee is hurting, for example. So you got to focus on both to get it together. Now, stress isn't just real, it's mental. It's just not mental, it's physical. So you got to look at this right here. Cortisol is a primary stress hormone. I don't care how we experience some kind of stress in some form or fashion, whether it's financial, whether it's a relationship, whether it's somebody irking you, you know what I'm saying? Maybe it's, I don't know. Cortisol drives inflammation. It drives systemic inflammation throughout the body. And that right there is what's killing a lot of us, is that when a heart becomes inflamed, it can cause a heart attack. If something becomes inflamed, a blood vessel, and it bursts, that could cause a stroke, or it could cause an aneurysm. If something becomes inflamed, that joint is going to swell and it will hurt, like a knee or something. So that inflammation damages the nerves and the organs. And so when you look at these things right here, pain and fatigue increase and the cycle repeats. So what happens is that stress triggers the cortisol release. Cortisol drives inflammation. Inflammation damages the nerves. And then that pain and fatigue increase that cycle. And some people live in that cycle. So your children and the people grant, this is a cycle that I see the younger people living in, even my age, because we're dropping like flies. I don't know if you noticed, there's a bunch of people like 50 years old just dying. This dying. I've seen it like 51, 57. You got the Leak family just lost their son. You got a lot of people just dying. And this is basically that repeat cycle over and over, and it's damaging organs. You have to break the cycle. Get a hold of them. Grab them by the collar. Tell them to sit down. I'm going to teach y'all a word today. It's called sit-yo. Sometimes you got to learn how to sit your butt down. I had to learn that, right? And be still. And we keep driving. The worst thing that could have ever happened is people work from home, in my opinion. And the people that work from home think it's the best thing ever. So we went to dinner, and I think I mentioned this a couple of times ago, about a year or two ago, with some of my wife's friends, and I was the only person that went to work. And some of them were overweight, on blood pressure medicine. We all the same age. We all 50. And they blood pressure medicine, then had this going on with their body, diabetic, pre-diabetic. And then what happens is, the reason why I think it's the worst thing, people have a laptop and they travel with it, right? Then they get into bed, they open the laptop. I'm a little older, so I remember you had a computer at work, and then you would just go to work, and you left what was at work at work. That's probably y'all generation. Now it's to the point where they're bringing it home and they're working into the wee hours night. If they're not working, they're strolling on social media. They're getting overstimulated, which creates that cycle that actually works. How so-and-so get on that vacation? I can't go on that vacation. The ladies at the Croc Center just came back from the Bahamas. I don't know how I can't go to the Bahamas. I ain't even there yet. It's all these different things that happen. So aging is not the problem. It's how we age is, right? And so when you look at these things right here, aging without support looks like this. Progressive pain becomes normal. Multiple medications with side effects, right? Balance issues and falls. It just starts getting worse, and it's like a little snowball effect. You don't fall all of a sudden. You've been falling 6 months before you fell. You just ain't pay attention to the signs. Then you got right here shrinking your daily life and activity. So now I know that I can't walk a mile, so I'm only going to walk to the step to the door and back and sit down. So we're not pushing. So our lifestyle is shrinking. And then we depend on others. It becomes more increasing. So when we start to work on family members, can you go do this for me? Let me call my nephew. He's going to come get this box down for me. And there's nothing wrong with that, but try to remain as independent as you can as long as you can. The other thing, you aging with a plan. You're moving with less pain and more freedom. Your clear mind, your stable energy. So now you got a plan. Say, Dr. Artis said, I need to work on this. I need to do this. Your strong balance and fall prevention. You're expanding your life. You're not contracting it. I want to see you all expand. Continue to travel. Continue to do the things you want to do. And then you want to maintain your independence as long as you can for decades. I love when I see a 93-year-old still driving and still walking around. I love 98, still living on their own. I just moved my dad to another nursing facility. You don't want to be in no nursing home. Man, taking me out back and shoot me. No, I ain't want to be in no nursing. Nah, unless you got to do that, and that's what you plan for, but that's not good. So your body has built designed to move every day. So you need to walk 30 minutes a day. If you can't walk 30 minutes straight, that's a good litmus test. That's a good test. You walk 30 minutes. If you can't walk 30 minutes, walk 10 minutes 3 times. Walk 10 minutes in the morning, 10 minutes in the middle of the day, and 10 minutes in the evening, and that'll help you to get to that point. And then gradually go to 15 minutes. Then gradually go to 20 minutes. But you can't start running a mile if you've never ran a mile or the marathon. Like some of y'all do always talk about. That lady had me cracking up when she was talking about she went to Greece and she walked all day and hurt all night. She never did 20,000 steps. So she was like, I was laying in the bed, knees hurt, no, taking this and this, because they never trained for it. So I'm always telling my seniors, you're about to take a big trip. You got to start preparing for it. You're going to be walking a little bit more. You're going to be distracted, so you're not going to focus on it. And then you're going to probably be hurting. So you got to kind of train for that. Now you got to also do your mobility daily. Simple morning routine, cat cow, gentle rotations, just kind of moving in ways that you typically wouldn't move. Bending your knees, trying to squat, all those things. Hip openers, chest openers on the wall, open your chest up. Can somebody open that door? Oh, thank you, man. And then you want to strength train 2 times a week. If you heard me talk, I'm a big advocate on getting those weights up there at the Croc Center. Not going and doing free weights, but just using the machines to actually move. Just go down and do the machines. This, chest press, shoulder press. Then you go back and you do the back thing where you're rowing the back. Then you got the one where you kick one leg out, kick the other leg out. You squeeze those things. Hey, and then you got all those things right here. But strength training is your best insurance policy. It's not the walk. Walking is good, but it's just not enough. I'm going to go to the Croc Center and walk. It's just not enough. You're supposed to walk anyway. You're supposed to walk to the bathroom, to the kitchen, to go to your car. But you got to strength train. You got to lose that because you will lose that fast. I've seen people have a surgery and then or have a disc issue or back, and they lose muscle mass in a month. They lose muscle mass just like because they haven't been using those muscles. That's what kills when women break hips. It's not the fact that they broke the hip. The hip is going to heal if it's done right. It's the time that they're down and they're recovering that actually heals. Because you lose it, and the older you are, the faster you lose it. Some of you can testify for that, right? You don't use it, you're gonna lose it. Balance training. Stand on one foot. Everybody stand up for a second. Let me wake y'all up. Oh Lord, come on, Miss Bissick. Don't shake your head. No, so what I want you to do is I want you to just stand on your toes. Just come up on your toes. We'll get that second heart pumping. Yep. Yep, just like that. Now when you stood on your toes, that's actually activating your second heart. That's getting those calf muscles to pump some blood around. And if you feel like your legs are tightening up, that's a good thing to do while you washing dishes or you cooking. Now, if you don't want to stand up, you can sit down and do it, right? Good. Now, the next thing you can do right here is I want you to just try to stand on one leg. Just try to lift that leg up and hold it. Good. Some of us, we're working on it. Good, good. And then you switch sides. So you get an idea of where you are. And your goal now, the game that you got to play mentally is not to get any further less than that. You need to go up from here. It's up from here, is what they say to you. You can sit down. Thank y'all for being a good sport. That's your balance training right there. It protects you against falls. It protects against a lot of these different things. Now, foods that actually help you right here. So everyday message to meal the body. So what happens is your body reads chemical signals. Anti-inflammatory, the most important non-prescription tool you have. Health, circulation, energy. Half your plate should be non-starchy vegetables and berries. Blueberries, blackberries, very good, high in fiber. They do a lot of things for the body. It's the powerhouse. Quarter of your plate should be a good quality protein. Now, I don't know where you are. Some people don't eat pork. Some people don't eat beef or red meat. So you could do chicken, fish. You could do eggs. They help with nerve supply. They got a lot of vitamin B in it and vitamin D in it. And that's why it's really good to have that. And then a quarter of your plate should be complex carbs. Complex carbs are what? They're different than simple carbs. They're slower to break down. What happens with them is they don't spike your blood sugar. Like rice, potato chips. Complex carbs will be like sweet potatoes, quinoa, legumes. They steady your blood sugar. If you're a pre-diabetic or diabetic, your job in the game you got to play is to minimize the spikes. The more spikes, the higher the A1C. Right? So the more spikes, the higher the A1C. So you got to minimize those spikes by making sure that you do complex carbs. And then you want to add daily some healthy fats in there. One of the ways to lose fat is actually eat more fat, healthy fats. So when these guys get in these bodybuilding competitions, some of them eat a really high fat diet. And what happens is that causes their body to burn fat instead of actually storing it. So healthy fats will be things like avocado, olive oil, walnuts. They reduce nerve inflammation. Like your body, your brain needs fat to live. If you don't get enough fat for your brain, that's how you can develop conditions like dementia and stuff like that. Okay. Now eliminate seed oils, added sugar, and ultra processed foods. Majority of and everything. Eliminate those things because they're bad for you. Eliminate. Now, your mindset is medicine. This is the third pillar of how we're gonna get this together. If you don't expect to get better, you won't. That's a fact. If you don't expect to get better, you won't. Some people just expect that's just what it is, or there's some kind of doubt in the back of their mind. When I deal with the people that are like 80 plus and 90, they come in, they expect to get better. Miss Betsy, that lady is something. She still cuts. She's 88, 89. She just turned. She still cuts her grass. She walking around here. She's not the most social person in the world, but she is on it with this whole like, hey, I just need help with this hip. Help me get back to so I don't slow my lifestyle down. But then you get some people come in and they say, well, you know what? I'm just getting old. And they play that psychological problem. So it's not like that. So neuroplasticity proves that research that your brain can change at any age. That means that you can learn something new whatever it is. You can change the way your brain is wired. Tell stories to yourself about the health space that the shape that you want to belong to, the biology you want to have. My body is amazing. My body can heal. My body can fight this off. Words have power, right? When your kid says something negative, you say, don't say that. Don't say that about yourself. Words have power. We got to say that with our own selves sometimes. And so when you look at these things right here, you start with simple things like sleeping 7 to 9 hours a night. You got to sleep. There's no way you can heal if you don't sleep. I always say that's why hospitals got beds. They want you to rest and heal. That's where your body repairs itself. And deep sleep is when your brain and nervous system reset. It's non-negotiable. Second thing is you want to breathe with intention. So when I'm saying breathe with intention, a lot of times I'll teach people breathing methods, like the 4, 7, 8. That means that you inhaling for 4 seconds, you holding for 7, and you blowing out real slow for 8. If you do 5 to 10 cycles of that, you will fall asleep. You'll fall asleep. Or most people, you get a book in front of them and you let them read, or you come to one of my seminars or something, I mean, you'll fall asleep, right? So that right there is a nervous system. This is good because this teaches you how to breathe. A lot of times we don't breathe properly, and then our lungs don't get the right amount of oxygen that we should. And then you got social connection. This is good for the coming to the Croc Center. This is good for coming to stuff like this, meeting people. When COVID came, it really destroyed our social connection. Research is saying loneliness raises inflammation markers as much as smoking connect daily. Loneliness raises inflammation markers as much as smoking. And most of the time when something is wrong, our natural inclination for people is to recluse and get back and hibernate. When the worst thing you could do is do that. Now, you got to be out there telling everybody your business. Oh, my toe hurt and all this stuff. You don't want to be that person, but at least connect and actually talk about something totally different. It will help you heal. And I'm not a therapist, but I just read the research. The other thing right here is practice of gratitude. 3 minutes of intentional gratitude measurably lowers cortisol levels all the time. One of the things, I had a journal that I used to write, a planner. And at the top of the planner, when you go through and plan your day, it has write down 5 things that you're grateful for every day. I missed that planner. I got to start back doing that. But it really kind of makes you think about certain things and moves you in the right direction of being grateful for what you do have. One of the things I always tell people too, they come in and say, Doc, but this pain is pain. Look, be grateful for that pain because it could be worse. I know people that done got a toe. Like I had one of my patients she just transitioned, but she lost her big toe or her pink toe. And she got to go to skilled nursing rehab to learn how to walk again. And she was like, I don't want to live like this. So she just refused food and she just transitioned last week. She's like 88, but it's just to the point where stuff like that, you got to appreciate what you do have. Because you got people that actually would kill to be where you are. Even if you got a cane, or even if you do got that. And then your game in your mind and my head would be, it's like, man, I just want to get better than where I'm at. And I want to do all the stuff naturally as possible that I don't cause any more problems. Now I have a new technology in my office. It's called a K laser therapy. It's by Indiba. But what it does, it starts healing on the cellular level. And what it does is that laser is designed to clinically use for NFL teams, Olympic teams, and now I have it in Tinley Park. So I cycle. If you know me, you've heard me talk before. I'm on the bike riding 100 miles, stuff like that. So when I went to this seminar, I met the guy that does the training, or the team trainer for the Spanish cycling team in Spain. And they traveled with this machine. So he did this on my knees, and literally I went away. I was like, whoa, my God. So then it's to the point where I've been going. So I found somebody in Chicago that was doing it. So I was like, man, I was going up there twice a week. When I do that 100-mile bike ride, I was going there twice a week for like a couple of weeks on my lunch break. And then it came about to the point where I just prayed about it and I ended up buying one. But since I've been doing it, there's a couple people that come here to actually get it. They went ahead, they said, I want that every time I come in. So even people that have knee replacement that still have pain. Like this one lady, they forgot to do her rehab right when the knee hurt. So all these adhesions, so she lost the being able to bend the knee. You know, you want to try to get 90 to 120 degrees of flexion. And so to the point where we started doing that, now she can bend the knee. I was breaking through the adhesions. And what it does is it increases oxygen, increases blood flow, and it stimulates the cells on a cellular level. So it stimulates ADP and mitochondria. So it speeds up the healing process 4 times faster than it normally would happen. And then you got also zero drugs and injections because they're going to try to sell you on stem cells and shockwave and all this stuff. And it's less than 15 minutes. It's literally like not even 4 minutes. It's pretty dope. Huh? So it's basically we put these glasses on and we hold this thing over. It's like a wand. And it goes that deep below your surface of your skin. Now, only thing is you got to be careful with tattoos. Some of y'all might have y'all butterflies and stuff on your body parts. So it might discolorate the tattoos because it goes that deep. It will penetrate and stuff like that. But it's really amazing. I use it on myself like almost every day. It is, but light red therapy is very minimal. It goes below the skin. So with those light bed therapies, you have to lay in there so long, right? Those are usually like 100, like 10 watts or 30 watts and stuff like that. They usually take a longer time. This is 100 watt, which is the strongest you can get. So the times are shorter because it's so powerful. And then I can adjust the settings on it when I learn your body type. So again, this is a person that came in. Oh, so I got another guy. So I've been running. I started a neuropathy program, and so this guy, he had bilateral knee replacement, but he had spinal canal stenosis in the back, and so he thought that his leg weakness was coming from his knees because he had a knee replacement. So he's walking with a cane. This dude really never really had any problems, any pain, but he can barely walk. He's losing his balance. You know, that's my thing now. So I've been doing his low back and his knees and his bottom of his feet. That dude is walking better. He was this close to getting surgery. Now he says, I'm not getting it. You're not getting it. He been in constant with Dr. Payne. He did a lot of people's stuff, man. But he's like, dude, I'm not doing it. He said, I'm not one to be cut on. I done been cut on too much with my knees, and it's doing that. So we come in, he's a happy camper. But he's one of my best patients on the neuropathy program that's recent. That was just in my office yesterday. And then what I've been doing too is I've been doing the other ladies for like 8 weeks. It's been putting in there. It's been really getting their life back. And then I add the supplementation in there with it, which is like the nitric oxide, the Innervate and stuff like that. And that gets the circulation down into the body and the nerve strings. I told you about the lady that got stuck outside. She's older white lady from Oakland. She's taking the garbage out of her building and she got frostbite on the bottom of her foot. So she couldn't feel her feet. So I've been working with her on it, and she's like phenomenal. She's on her second round of the neuropathy treatment. She's got her feeling back in my feet. Now, this is the same lady too. She has osteoporosis, and she was bent over and fractured a vertebrae, bent over. That's how soft the bones are. So you got to be strong with the bones. So we were being able to go around the area that she actually had fractured, the compression fracture, and it actually started to speed that process up with the healing. I got another lady that was referred to me yesterday that walking outside her house to take the garbage out and slipped and fell, right? So the previous patient, older lady, and what happened with her, the railing off the go up the rail, those metal rails fell off and broke her radius and ulnar right here. So she had it fused with a plate in there. She wanted to do a rehab with me, and I've been using it on there. Now she's balling her fists up. She's actually seeing a difference because it's speeding that blood process up. And I'm not saying it's a cure-all. There's certain people that I don't use it on, like you got epilepsy or you got some other conditions. But for a lot of people, it can actually do it. What about chemo neuropathy? Chemo neuropathy can, long as you don't have any active form of chemo now, like any or cancer now. Like you don't want to use it on cancer because that's a contraindication. Epilepsy, if anybody has seizures, that light flashing, it can actually stimulate them to have a seizure. It's a couple of different things, and I have to talk about it individually. But one of the things that I always think about what I'm doing is it's not a pit stop, it's a partnership. It's whole body care. So we combine in chiropractic care, rehab, nice nutrition, and lifestyle in one cohesive plan. And then with personalized attention, we're trying to work with you on those different things. And then with the K laser, I got people that just do that. And then also with move well, think well, those three pillars that we put together, and eat well, that's where your body's going to get it going. So the cost of waiting with these things right here is every year it accelerates that nerve damage and it causes more problems. Then you got circulation is left untreated. That causes, tissue death and ulcers. I had a young guy too come in yesterday, diabetic neuropathy. This is a 48-year-old guy with a sore on his foot that got infected. So he was about to lose his pinky toe, and we started working on him. 2 treatments, he's feeling better. 2 treatments, feeling better. That's diabetic neuropathy, which is different. But poor circulation, untreated tissue ulcers, untreated issues is balance, 1 in 3 falls over 65. And then you got managing medications with drugs don't address the root cause. So the gap between how you feel and where you should be is getting wider. And we don't want that. So the good news is right here. You imagine 90 days from now, you wake up, you take your first step, and you're getting better. They don't call me Dr. Hope for nothing. Like I'm passing out hope, and it lands. And everybody might not get it. Might take some people longer. We always we want stuff now. You got the microwave mentality. So we want to put it in 30 seconds and you want to be back, but you got 40 years of damage. It don't work like that. It don't work like that. So you got to have energy that lasts past 2 days. Imagine that. Your mind is clear, your mood is stable, you're doing more activities than you thought. And then you no longer, are just managing, you're thriving. You're actually getting better. It all starts with that mindset, and you feel more confident walking and moving. I think you can do it. You got to do it every day. I'm telling you, the people that don't, you got to do this stuff like you brush your teeth every day, or you take your dentures out and put in that solution. You got to do this like that. You got to do it like that. That's how real you got to be with it. I'm not being funny or anything, but you gotta do this stuff every day, because your body it's got to develop a pattern, a rhythm of learning how to do it. And that's one of the things right here. So 3 actions you could do today. You could schedule a consultation. You could take a nerve assessment test, and you commit to the 90 days. Just 90 days of just having a new you and a new, better you. That's the next step. And so introducing my neuropathy program. So what I've been doing is the K laser treatments, the spinal decompression, home exercise program where they do stretches every day and they do strengthening stuff every day at home. And then circulation enhancement, which giving you stuff to help with blood flow. And then nutritional protocol, the same thing. And then progressive tracking. So every 4 weeks we sit down looking at what you're doing. And so I've been trying to literally slow down and focus more on that to help people with different things. Now, any questions, anything? Any questions? Yes. No, no, no. There's different things. Neuropathy is kind of what I've been, because a lot of times I started on this balance journey a while ago. And when I started doing the balance thing, because I kept having these people falling. And when they were falling, the one lady shattered, she had to have a shoulder replacement. The other lady broke a hip. She had to have her hip replacement. Then they were falling. I had another lady fell and she had a bleed on her brain. So it's a lot of, I said, man, what is going on with these people falling? The number one reason why people fall was neuropathy. And then I started a whole can. So I started doing research and I started looking at different things and I started putting it together. So the main thing is to actually see what's going on with you. Everybody's different. But a lot of people know they have neuropathy and they think they're supposed to live just with it. I'm letting them know that if you got neuropathy, it can get better. It depends on how advanced it is. The only ones where I've seen it not get too, where it's not big of a change, is the one from chemo. It's something about that radiation and chemo that it just kills the nerve roots. And so that could be kind of permanent. But as far as peripheral from the nerves, and far as from diabetic, that can get better if you just maintain the other stuff. That can get better. That almost can get, I would say, anywhere from 60 to 100% better, depending on how advanced it is. Mm-hmm. 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 In my opinion, the gel shots are just like a temporary thing. It doesn't. Some people get relief out of them, but the amount of people that get relief out of the ones I've seen and the people that don't is very low. And that's just basically trying to inflate a gel in there to actually remove some of the space. The only way that you could do that is you have to strengthen the muscles around that joint to actually stabilize the joint. The number one reason why people get bad osteoarthritis is instability of the joint. That means that the joint is supposed to move like this, but it's moving like this because the ligaments are damaged. So there's ways to do it. If it's not bone on bone, if it's bone on bone, you're very limited in what you can do, but you can still give it stability. And there are different ways you can do stability. Um, you got PRP. People talk about that. Have you ever heard of PRP? PRP is plasma, where they take your blood, they spin it down, they take the plasma out, and they inject it in the joint. But again, if it's bone on bone, it's not going to be effective. Even stem cells, if it's bone on bone, it's not going to be as effective. Those are only really good for like PRP is good for inflammation, but the stem cells and the PRP, in my opinion, when you first injure a joint, like if they're a younger person and they tear ACL or MCL or meniscus, if they get that, their recovery time is way better. But if it's bone on bone, there's no shortcut around doing the work for strengthening that joint. Even if you get a replacement, you still have to strengthen the muscles around the joint. And I've seen people do it. Half of the people that I work on their knees have had knee replacements. They've had knee replacements, but it's like to the point where it's like where now you got people, they were doing the jiffy knee, they were doing the regular traditional knee replacement. A lot of doctors don't even do the partial ones anymore, but they just do a complete because they know they got to go back in. But I mean, there's hope. You can get better with knees. You can get better. It just depends on how long it's been going, how bad the degeneration is, how severe the arthritis is. And the only way that I can see it is with doing an exam and taking x-rays. Doing an exam and taking x-rays. That because you can see where the bone is. Yes, ma'am. Prostate cancer? No. Lifestyle change. Lifestyle change. Yeah. But that's a big thing going on with me. And no, this is totally different. This is a totally different scope of practice. Totally different thing. Prostate cancer, the genetic part is increasing, but also lifestyle, and you got the external factors that play part in it. So but yeah, prostate cancer and the swelling of the prostate. That's something that as far as men, we got to look out for. We got to watch out for. It's a good question though. But no. Yes, ma'am. Mm-hmm. Mm-hmm. No, it depends. If the shot, so the shots, the steroid shots are designed to actually block the pain pathway back to the brain. Some of them they can pull out the inflammation, the stronger ones, but eventually what they do is they eat away at the cartilage. So it's more like a life jacket to kind of take the pain away, right? Um, you have to continue to do exercises to strengthen the muscles around the joint. It goes back to that therapy. I'm very big on rehab and therapy with that because that joint is unstable and it's kind of wear and tear on it. And so as long as you can keep that joint strong and you can like your biomechanics are on point, it'll go away. It will stay away because you're not really stressing the joint. But the joint is still messed up. The answer to your question is once you have it, it's there. You can't reverse arthritis and degeneration. You just want to slow it down from getting worse. You want to prevent it from getting worse than what it is. Oh yeah, you need to be on the thing every day. To some sweat coming down. Yeah. That's good. Yes, any other questions? Yes. Right, right. So osteoporosis of the hip, the best insurance policy to do that is you got to lift weights. You got to get the muscles stronger. The muscles are stronger. They're going to pull on the bone. That helps increase bone density. Now, from a nutritional standpoint, they're giving people calcium. That's where your vitamin D. You want to make sure those levels are up to point, but really not to stress that joint because you could break it. Yeah. So you got to really eventually get into low impact stuff, the swimming, walking in the pool, the recumbent bike, but not, you won't run a marathon. No. It'll fracture it. It'll create a condition called avascular necrosis, to where it decreases the blood supply to the head. And if that happens, it just literally is going to snap because it has no blood supply. Because the blood again takes the nutrients back. So if you can increase that and put the right things in, you can change it. You can change it. It's just really just kind of coordinated and a plan of action for specifically that and trying to do it. But yeah, thank y'all.
It's scary because when you hear so many times of people who, once they break a hip, it's downhill.
Mm-hmm. Yeah, and you got some people that have broken them and they doing okay, but that's a very small percentage. So it is. So do everything you can to kind of do it nutritional wise and everything that's going to minimize it, even if it's down to losing weight for some people. Some people, simple thing for them, lose a few pounds. It can make a game changer, especially with knees. If you lose, they say 5 pounds is like 15 pounds off your knees. So that's less weight. And it's not like some people are big or anything anyway, but it just makes you lighter. But you got to strengthen those bones, and there are ways to strengthen them. All right. That's all. Thank you all. Yes, ma'am.